Hi everybody, welcome. We'll be starting in just a moment. There's still a couple of people to arrive. I'm George Valiotis. I'm the Executive Director of the European Health Management Association. And in a moment, I'll introduce our speakers, but just really appreciate everybody making time to come today. We try to keep these webinars to just half an hour length so we can give you some useful practical information to help you out immediately and not take up too much time. You're in for a treat because we've got two fantastic speakers and they're going to give you all the information that you need for now. If you've got any questions, feel free to type them into the chat box as we go along, and then we're going to get to them at the end. We are recording this webinar as well for your information, and they'll be up and available on our website shortly after. So what we're going to cover today is health systems and health literacy in the midst of the coronavirus outbreak. Both the speakers collectively will cover the importance of health literacy, the role of health managers and decision makers, and how can health managers facilitate developing a health literate society. And there'll be questions and answers at the end. The way we'll do it is this current overview, which is just finishing up with me now. Then you'll have a presentation by Stefan van der Broeke and then Kristine Sørensen, so 10 minutes each, and then questions and answers at the end. So to give you some more information about our speakers, first we'll hear from Stefan. He's a professor of health psychology at the University of Louvain in Belgium. And then immediately after him will be Kristine, who's the president of the International Health Literacy Association. So without further ado, I'll hand you over to Stefan.
Thank you. Thank you, George. And welcome everybody. I'll be very happy to talk about health literacy and giving an introduction on health literacy, but also why health literacy really matters within this pandemic outbreak. And so I'm talking on behalf of my university, of course, the Université Catholique de Louvain in the south of Belgium, but also on behalf of the International Union for Health Promotion and Education, where health literacy is one of the topics that we're really interested in and doing a lot of work around. Can I get the next slide, please? So I don't think I have to introduce COVID to you. I think many people have almost too much information about COVID. And I think what is important to put this presentation and this webinar in its context is that we will not focus on the disease itself, but I think it's important to look at the important impact of this pandemic. It's been, in fact, for everybody very obvious that not only the pandemic itself, but also the measures that are taken to prevent the virus from spreading and to make sure that people who are infected get treated, that it takes unprecedented measures, and that we have actually never witnessed this in modern history. With schools being closed down, with work being stopped, with restaurants and catering being stopped. So the impact goes far beyond the health impact and has a huge impact on society. It has also a lot of disruptive implications, not only on the economy, which is very much focused also in the news and in the coverage, but also on everybody's personal life. And in that context, I think it's really important to talk about the people and the need for people to regain self-determination, to face the challenge of COVID. We have to really make sure that people feel empowered and self-determined, not only because obviously, as is generally recognized, the protective measures against COVID and against being infected require a lot of behavior change, social distancing, which I think is actually spatial distancing. I hope we're not socially distancing, because we are now also socially interacting despite the fact that we are spatially distant. So those are factors that we know and recognize. But I think which is maybe also very important to emphasize is that within the response that we get to COVID, there is a growing perception that the health system is not really managing to protect citizens against the spread of the disease, and that there is a need to gain or to regain control. And then we really get into the nuts and bolts of health promotion, which is all about regaining control by people of their health and what impacts their health. And within that context, of course, it's important not only to look at how to protect oneself against the disease, but also how to manage all the consequences that it brings with us. Now, to manage your own disease and your own life requires information and dealing with information. And This is what I'll work out on the next slide. So why is it important to then talk about health literacy in the context of COVID-19? Well, people want to face the pandemic, and that means they must be well informed, of course. So not only to take preventive measures, but also to deal with the consequences. The issue is, however, that there is not a lack of information. On the contrary, with regard to this pandemic, there is probably far too much information. And dealing with information needs to take that into account as well. Not all the information that we get is useful. And some of the information that we get about the disease and about ways to protect and about the origin of the disease is actually wrong, or at least very biased. And so this is something which often happens when we deal with information in health. But in the case of this pandemic, it's probably even larger than ever seen before. I think we should also recognize that when there is too much information, the information is not just no longer helpful, it can actually create confusion and actually have the opposite effect. So adding more information is not going to be the answer to dealing with COVID-19. Actually, what needs to be done is to make the information that people can access, to make it health literacy proof. That's a term I would like to suggest here. With this term, I mean that not only should information that is provided by authorities be understandable, transparent, and consistent. Consistent does not mean that you cannot have progressing insight and that new information cannot be gradually processed, but it means that the information is consistent and does not contradict each other constantly when it comes from different sources. I think in order to do that, and then we get really in the nuts and bolts of health literacy, I think we have to acknowledge that in order for information to be used, it needs to be taken up, of course, so people have to get access to it, but it also should be understood and accepted. Not always that is the case. So sometimes information gets to the people, but sometimes people don't understand it. And very often people don't want to accept it, even when they understand it, because it's contradicting information that they might already have or that they get from other sources. So this is all an active process, and I think that's what health literacy is really about. It's this process of accessing and then also appraising or judging the information, understanding the information, and then applying it to the decision-making process. So this is the definition of health literacy as we know it and as it's often used. There are other definitions often suggested, but I think this one is rather consensual. And I think it's important to recognize that health literacy is a means to make decisions in terms of prevention, in terms of improving health, and all that during the life course. Can I get the next slide, please? Within the literature on health literacy, you find not only different definitions, but I think it's important to emphasize that the way we talk about health literacy has changed over the years. Health literacy has been around as a concept for some time, but we've seen a change both in terms of the meaning and in terms of the actual scope that we can find it. So originally it was usually seen in the medical context, and I think it's good to refer that as medical health literacy. So with really an emphasis on more functional individual competencies, for example, understanding the information received by a doctor or a nurse or a dentist, and also very specifically focused on numeracy and words. So very functional. But that has been enlarged now, not only to a wider field. So health literacy is not just important within the health care, but also in prevention and health promotion. So we see an expansion of the field. And we see that there's much more focus, apart from not only the functional aspects, also on interaction and on the capacity to find information and to make decisions, to also think critically about the information. So it's not just understanding and passively receiving information, it's much more being able to ask questions, to check if the information is useful or not. And we see that in this sense, health literacy is not only getting a lot of attention in research and an enormous expansion of research, but also getting a lot of recognition politically and societally. This happens both internationally and nationally. Internationally, we see, for example, that in the Sustainable Development Goals it's mentioned. It's very strongly also promoted by the World Health Organization. And we see that more specifically in Europe, there's now work being done on a resolution and a roadmap, a draft roadmap to implement health literacy initiatives. But there's also a lot of interests at national level, and research by amongst others, Jill Rowlands has pointed out that in an increasing number of states or member states in WHO Euro, we see that there are health literacy policies and plans that are being developed, that various sectors are really taking initiatives. But we see that, that it's still very wide, and that it's also not necessarily integrated. So I think there are still some gaps in the attention. Nevertheless, I think we see that it's becoming very much focused on. Can I get the next slide, please? We see that this is accompanied, not only this political interest is not just political, it's also a reflection of a societal and scientific process. So we see that there's an enormous activity around health literacy, both in terms of conferences, in terms of books and publications that appear. There are initiatives made. So we see that this is a field that obviously has a lot of attention. So I'll go to the next slide then. So why do we get all this attention from researchers, from politicians, from citizens and society? Because I think health literacy is important, not only in the context of COVID, of course. We didn't need COVID-19 to find out that health literacy is important. I think there are a number of reasons, the most important of which are summarized here. I think, first of all, I think it's become clear over the years and through a lot of research that health literacy is an important determinant of the use of healthcare and the good use of healthcare. And therefore, it can also be a good way to reduce costs of healthcare. And not only that, it also links to health outcomes. So there's an increasing number of studies showing the links of health literacy with healthy lifestyles, but also with following up the recommendations by doctors and other health care practitioners. And more so, this translates also into health outcomes in terms of life expectancy. It is also an important outcome, I think, of health education. Now, I'm a health promotion person, and I think for years we've been struggling with the fact that measuring the outcomes of health education and health promotion is not so important. It's not so easy, sorry. It's very important, but not very easy when you look at behavioral outcomes. But health literacy is a more direct outcome of health education as part of health promotion, and therefore is really useful also within health education, health promotion world. And then last but not least, it's also a mediator between social, economic, and educational differences and health inequalities. So with all those reasons to look into health literacy, I think the question is, how can we actually address this phenomenon? I think there's basically three ways. So if you think of health literacy as the place where people's competences and skills meet the demands of the health system, then there's three ways that can be followed. One is to look at the personal level of health literacy. You can measure that, and there's an increasing number of studies that measure that at population level, and to improve that at population level. Basically, this is to continue investing in health education. So that's on the left-hand side of the slide. Secondly, we can try to improve the fit between the competences people have and the demands of the system. So if we manage to identify people with lower health literacy skills and adapt our way of dealing with them, I think that is also a good way of answering health literacy or low health literacy. And thirdly, and I think Kristine will talk about that more in a moment, it is also the possibility to reduce the demands of the system. If we make the health system easier to navigate, then of course that will reduce the need to have health literacy skills. So these are three ways to do that. And the health sector has a very important role to play in this. So first of all, the health sector or health professionals can act on the second way to address health literacy. They can compensate for low health literacy in patients by screening for low health literacy and then adapting the way communication takes place. Now, there's a number of elements that can be built in. So making sure there's enough time, slowing down conversation, using visual supports, etc. So these are all important ways. It's also important to check if people have really understood the information. In addition to that, it's also possible to do specific training, especially for those people who need special information or special attention and build their skills to manage their own health. So we see this with chronic patients, that there's an additional effort being made in self-management training to take low health literacy into account. And then the last way to address health literacy is, of course, to try and make the whole health system more health literate friendly, make it easier for people to find their way, and to follow up on the instructions of healthcare professionals. Now, the problem here is that this is easier said than done, because as you all know, without doubt, health professionals and also people who are trained to be health professionals are not necessarily selected for communication skills. Now, don't get me wrong, I'm certainly not going to say that communication is not considered important. And of course, in the training of healthcare professionals, there's a lot of investment made on communication, but not necessarily on health literacy friendly communication. So I think here there is still a bit of attention needed. And that, I think, apart from the training, there's also the context in which health professionals have to work, which does not necessarily facilitate paying attention to health literacy because of the efficiency concerns, lack of time, sometimes also because of a lack of awareness about the need to address health literacy. There have been studies that show that indeed there is still a lack of awareness amongst health professionals, especially in the US. There has been some studies about that. So I think it's important to also build that in the curricula, although they are already quite crowded, but I think it would be good to find a place for also health literacy to be taken up there. And there are some interesting initiatives underway to build health literacy training for healthcare professionals also in Europe. There's been some in the States as well, but they focus mainly on the functional health literacy skills, whereas in Europe there's been some interesting initiatives to make a more comprehensive health literacy training for various health professionals, not only doctors, but also other healthcare workers in training. And the interesting thing here is that it's taking a comprehensive approach, looking at the functional, but also interactive and critical health literacy aspects in the training of healthcare providers. So these are some interesting developments I see in the training, and of course we'll see the results of that hopefully in several years. So this is, I think, one of the things we should really look into, to build more capacity of the healthcare workers and healthcare system to address health literacy within the system. So that takes me to my last slide. So this presentation about health literacy obviously is triggered and is taken up in the context of COVID-19. And I think it's got its place here, because to make informed decisions about this horrible pandemic, I think health literacy definitely has its place. And like for other problems actually also in health, also for COVID-19, the problem is not that there's not enough information. On the contrary, in this information society, the problem is actually that there's too much information, and we have to help people to make sense, to help them make sense of the information that is there. So to get access to reliable, useful information that is really helpful rather than confusing. And in order to do that, I think we have to really understand the process of health information seeking, understanding, evaluating, and applying the information that is necessary to become more self-reliant in terms of health behavior and taking care of yourself. This can be done in different ways. It can be done through education to increase the level of health literacy. It can also be done through detecting and compensating for a lack of health literacy within the healthcare system, but also to try and reduce the demands of the system. And this also translates into COVID, of course. If we make the information easier for people to access and understand, then I think we'll see the results of that in a better way. This is not just a task or responsibility of the health sector, of course, but it is also a task of the health sector. It is also a task of civil society and of policymakers. But I think in the context of this presentation, I think it's important to look at the health sector in first instance. I think it's important to realize that it's not just about reading, writing, and understanding. It's really professionalism we're talking about. And I'd like to end on that note and leave the floor to Kristine.
Terrific. Thanks, Stefan. I'll hand over to Kristine in just a second. I can see people are starting to put questions into the chat box, so I'll encourage you to keep doing that. Kristine, over to you.
Yeah, thank you. And also thank you for the invitation. I will summarize my presentation in 3 points, talking about how health literacy is a public health challenge that we cannot neglect from a management point of view, and zoom in on the perfect match, and then essentially also giving you a concrete tool that you can use. So Chiara, please, next slide. We know already for several decades that health literacy is a topic that is very important. And Ilona Kickbush has been one of the European champions, saying with her colleagues that to be a health literate society, we need a health literate public, health literate health professionals, and health literate politicians and policymakers. And where the politicians probably didn't really think themselves as stakeholders in the health literacy field, with the COVID-19, they are certainly on the spot all the time to provide timely and appropriate and actionable information. So health literacy is very much in the spot right now. And this was the definition we had developed here from a European perspective, where it's about accessing, understanding, appraising, and applying information to make judgments when you're ill, when you are going to prevent yourself from risks and trying to stay healthy. So really it's about managing and dealing with health. Next slide, please. And what I would like you to remember from today is really how do we make that best match. So you saw this slide from Stefan with the arrows, which is from our American colleagues, about people's skills should match the complexity of the systems, but with the enhanced focus on people-centered health and tailor-made solutions, I think it's for us coming from the system side to actually turn around the arrows. So it's about our skills in the organizations to match the complexity of people. Previously, people were directed in all directions for several problems, but now I think we need to look at how can we design better processes, better procedures that will actually help people to get the right treatment or the right response or the best product in the first go, not that they have to run all over the place. And that leads us to the health literacy responsiveness, which is how we as organizations and healthcare providers promote equitable access and engagement. How do we meet the diverse health literacy needs and preferences, not only of individuals, but the whole family and caregivers and communities? And how do we best support the people to participate in their own decision making? Next slide, please. And in New Zealand, they have focused on 6 dimensions on how to create a health literate organization. So a health literate responsive organization. First of all, leadership and management. We cannot do anything without the management buy-in. We also need to ensure that we fully understand our users, that we have trained our workforce, and that we really meet the needs of the populations that we serve, and that they can easily access and navigate the programs and the initiatives that we provide to them. And then fundamental part of all this is communication. And I think this is really where we see all the gaps coming up and being visible with the COVID-19, where it's been difficult for the management and political management to set a direction. The users weren't involved. We didn't train our staff to be prepared for a pandemic. We are not completely clear of the needs of the populations, and people have really difficulties in finding the right information and to fully understand the communication around the COVID-19. Next slide, please. So the Ministry of Health in New Zealand, they proposed that that we review organizational procedures and services, and they do it in 4 steps. Get introduced to health literacy, so everyone knows what it is, that you prepare for making this review and for conducting it, and then learn from it to develop an action plan. Next slide, please. And here are some of the small steps that you can take in these 4 steps. So you could start doing it today if you have the resources and the time and the focus to improve your organization to advance on health literacy, not only of the users, but also from the services that you provide. Next slide, please. But I fully recognize that we have our hands full with doing COVID-19 or dealing with the COVID-19. So what you can do if you don't have the opportunity to do a full review now is to do a quick health literacy assessment and ask yourself, or have your staff asking, you know, the things that you provide to your clients, to your patients, to your users, is it easily accessible? Is it easily understandable? Can people judge if this is relevant for them, and can they easily apply what is needed to be done? We saw in many countries that, for example, the hotlines to the medical services were overwhelmed with questions and from worried people. So they were actually not using the system in the best way, because with their questions they were blocking for those who are seriously ill. So in those last weeks, most countries have now found a way where they can guide the citizens who have questions on the COVID-19 to a specific hotline, Corona hotline or whatever, in various languages. So it's easily accessible, easily understandable, and that the staff there help them to judge if there is something they should be concerned about, and if there are, where do they go next? Is it to the medical doctor or for a test? But it's taken some weeks to redesign the systems around the response to COVID-19. But this is really the quick and dirty way, and always also test your information or your product or your service with the users. We've seen too much material that has been produced really rapidly and it's been sent out without being tested. And then it's becoming part of this infodemic that Stefan was talking about, which is just too much and people don't understand, and it's too biased. So we need to help each other to really do quality products. If you want to know more, here's the list of references, and I know the PowerPoints will be available for you. The International Handbook is free as part of open access, so you can download it or get in touch with Stefan and I after the session. And my last slide is really that for many years we've been talking about health literacy, but we didn't see full action. I think now with the Corona-19, this is a disruptor. And the more health literate that our public is, the more health literate our decision makers are, the more you as managers are acquainted with health information, then you will also be able to serve your users in the best way. If we don't do it, we have too many people who do the wrong thing and overburden the system or don't come when it's necessary. Thank you for your attention.
Terrific. Thanks, Kristine. That was fantastic. I'm applauding for you. I'm sure everyone quietly is doing that as well. We've got a couple of questions that have come in. While some more questions get added, my colleague Laura is going to put up the link to the evaluation. The evaluation takes 90 seconds. It's just a couple of questions, and you need to copy and paste it into your browser. If you could do that as soon as you see it in the chat box, it's just up there now. That means a lot to us. It's our way of giving feedback to the speakers. It's your way of applauding the speakers or giving them any questions or feedback. And it helps us grow this series. I'm going to go to a couple of your questions, and we've got about 5 minutes left on this session. So the first one is from Anna Sjostrom. Apologies if I've mispronounced that. So her question's about screening tools. Now, Kristine, you talked about a quick and dirty way of screening, and Stefan, you referred to this. Are there actual specific screening tools that can be used in healthcare?
Oh, Stefan, you're muted.
So Laura, thanks.
Okay, I'm unmuted now. Okay, thank you. Yes, there are some tools that are available, and I would refer to the Health Literacy Tool Shed if you want to find specific tools. So Health Literacy Tool Shed is a site, it's a repertory actually of tools and measurement instruments, and some of them are specifically designed for that. But also screening could be done the quick and dirty way, both like Kristine said, in a more organizational way, but also in an individual way. So there are certain giveaways, for example, if people find it difficult to look at things on a paper, say they need their glasses, those are often smaller giveaways of people feeling very unsure about dealing with health information. So there's these are typically things that are being taken up in communication training with regard to health literacy in education and training for addressing health literacy.
Okay, great. Did you want to add anything to that, Kristine?
I'm fine.
Okay, so we'll put the links up to these things like the Health Literacy Toolshed that Stefan has mentioned on our website. And the next question is from Doris Monnier, and she asked about the role of health literacy in changing where the burden of access is. She's saying that there's people who need chronic health care or whatever in hospitals can't access it. And is there a role of health literacy in improving the way that that's done?
I think there is it's a mix of things happening. Some people are staying home because they don't want to overburden the system. I think perhaps also we saw too many going to the system before, so that was part of it. So some of them, rightfully now stay at home, but there's also a big problem that those who should actually seek the help and who are afraid to go, that's not health literate. That's not being health literate. Health literate is when you know when to go at the right time for the right services, and we as services provide the information so they are sure to make that decision. So there is an adjustment we need to do, and I think it was also part of political decisions that in many countries the systems closed down completely, where it might not have been necessary, or it scared people to come. So we have to find the balance. We're basically building the car while riding right now. And I think that is what we saw happening, and therefore we lost some of our passengers along the way, not only to Corona, but to other things too.
And so do you have any advice about what timeframes we should be thinking in? Because on the one hand, we've got an emergency crisis in front of us, especially in Europe right now, but also I'm seeing predictions of this being with us for many years. And from looking at your slides, some of your work is about longer term thinking, versus I think a lot of people right now are in crisis mode. How should we be moderating our planning and responding to health literacy in that context?
I think we have to learn, and we have a close collaboration with colleagues in Asia who had been going through this sort of crisis before with SARS. So they certainly had a preparedness system in place, which we haven't had in Europe. We didn't think it was a threat. So I think we should learn and advance to have this kind of preparedness system in place when it comes the next time. I don't think it's a matter of if. I think there will be, and this will take also time to go before we have gone through the Corona situation.
Okay, we've got time for a few more questions. If people can also please copy and paste that link to the evaluation, it does mean a lot to us to get that feedback. Stefan, did you want to add to that?
No, I totally agree with what Kristine just said. I think, in fact, we have a little bit forgotten about the possibility of viral infections. I mean, in the whole of health promotion, but also in health literacy, the focus was much more on chronic disease, never really, apart from HIV, not really on viral infections, transmittable diseases. So I think we're learning to pick that up again. And I think health literacy there has its place, as I think this seminar also shows. I think we have to see this as a way to help people to become more self-determinant and more taking care of themselves. This is something that, of course, will not happen overnight. It is a longer-term perspective. But I think it has to be not one or the other. I think we have to do both. We have to address the emergency of the situation, but we also have to think of what comes next. And like you say, it's going to be something that will be with us for quite some time. And there might be other situations like this in the future, and it's good to be better prepared. That's people know where to get to information and how to deal with it. I think this is something that's going to be helpful.
And people keep saying to me also, well, there are many more people who died from influenza. And I then say again, but this is basic thing. They didn't have to die from influenza if we were washing hands, if we were keeping a bit more distance, maybe not as extreme as now, but a lot of those deaths are also preventable. So I hope this will also be a learning lesson on how do we want to create a healthier world, a healthier lifestyle after the corona, using these basic health things such as a better hygiene.
Okay, I want to quickly get to the last few questions. There's one from Thomas Alvin about, do you think that there's a role for the EU authorities to have validated websites with validated information?
Yeah, I think that's a good question. I think that would, of course, be very good, but I think it's not very realistic. So there are websites that have this information so people can access them. But I think we have to be aware of the fact that finding information is an active process. So people might go there, but also might decide to take other information. And there was a question about digital health literacy there as well. I think that's part of the answer to that. I think we have to make people more aware of the fact that information needs to be checked when they want to use it. So I think we should invest more in digital health literacy as part of health literacy, not in order to control what people get in terms of information, because that's not controllable, but in order to make people more capable of seeing which information is useful and applicable to themselves. So I think that's part of the direction we should go.
There's a question about a glossary, which I think is a really good idea. And I know our colleagues in the Netherlands from FAOS, they have made like a whole glossary of all these new terms that came up with the COVID-19. I don't know if it's possible to translate that to other countries. But for example, I had an example yesterday where someone told me that COVID-19 was called COVID-19 because it was number 19 of the coronaviruses.
Right.
Where most of us know already that it was because it was a disease identified in 2019. So there are some things that we don't even think about that can be misunderstood. So the more we can be aware of clarity and translating more difficult terms into simpler lay people words, that would be helpful, I think, for many of us.
Okay, we're pretty much out of time. I'll take this one last question, which is from Irati Kronigune, who says, is there a best practice example of health literacy that you can identify in any country?
I think it's very early day to really say anything about good programs for this, but I think they are in full swing and full development. So I think we'll have, I hope we'll have some good answers soon. But I think the main way we can inform reaction to COVID-19 now is to basically rely on what we already know from research done in the past and to try and implement that as much as possible.
During this time, you know, there's never been a more important time for European health systems to be coming together and having exactly these conversations. We'd encourage you to keep doing that with us. If you're not already an EHMA member, check out that link for more information. And a big thank you, especially to Stefan and Kristine for putting a lot of time to prepare this and to speak today. So I applaud you. I'm sure everybody will applaud you in the evaluation. And I hope to see you again. We run these webinars every week, so stay tuned on our social media to find out about the next one.